Hello, good afternoon, good evening, and good morning to everyone joining our live Q&A session today with Dr. Kate O'Brien, who is our Director for Immunization, Vaccines, and Biologicals. We had many sessions with her before, so I'm sure you know her well. But today's occasion for this session is the World Immunization Week that started yesterday. For those who are following us on Twitter, we had the Twitter Spaces chat to set the scene for the week. But today we are using this format across platforms to tell you more about the World Immunization Week campaign, but also to answer any questions you have about vaccines, including on COVID-19, to Dr. Kate O'Brien. So if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, please use the comment section, and I will pass your questions to Kate. Good afternoon, Kate. Thank you for your time.
Well, it's so nice to be with you on World Immunization Week, on our second day of World Immunization Week.
Yes, today in person. So happy World Immunization Week. And Kate, maybe while we're waiting for questions, we can remind our viewers, why are we marking this campaign every year?
Yeah, so, the last week of April is always World Immunization Week, and it's an opportunity really to kind of shout from the rooftops about the benefits of vaccines and immunization to assure that people all over the world have this clear understanding about what the value of vaccines are. And understand the importance of programs to immunize everybody who has the opportunity to have vaccines. And we have a theme this year, which is Long Life for All. It's really emphasizing that vaccines are not just for infants and children, or even just infants, children, and adolescents. They're for people across all age groups. And of course, the COVID pandemic and COVID vaccine is one of the best examples of the importance of vaccines even into our older years.
Thank you so much, Kate. And I'll use the opportunity to remind our followers that there are some quizzes on our Twitter channel that will last throughout the week. So if you would like to test your knowledge about vaccines, please check this thread. Also, across all social media platforms, we are pushing out some interesting content, and we invite you to have a look, but also to share it with your friends and communities. We really welcome your support. Kate, what is the state of global immunization at the moment?
Well, we've all been through a really difficult period of 2 years or so with the COVID pandemic. And one of the impacts of the COVID pandemic has to result in a backsliding of the performance, the ability of immunization programs to reach the people who need to be vaccinated. And the result of that is that we now have about 23 million children around the world who have not received the vaccines that they should have received. And of those 23 million children, about 17 million of them have never even gotten a single dose of vaccine through the routine immunization program. So we're in a bit of a hole right now where there's been the loss of about a decade's worth of progress in immunization programs around the world. And what does that actually mean from a human perspective? It means that there are going to be deaths of children, of deaths of older people as a result of diseases that are otherwise completely preventable from vaccines. So it's really important that every country, every community, every family around the world does whatever you can to catch up on vaccines that have been missed.
Thank you so much, Kate. And here's already a follow-up question from one of our viewers on Facebook about measles vaccinations, current gaps, and that maybe we can highlight why it's important for everyone to get this vaccine.
So measles is a virus. It's a viral infection that mostly affects young children. And it's one of the most infectious viruses that we have. We've all learned in the COVID pandemic about the number of people that one infected person can go on to infect. But measles is probably the most infectious disease that we have, and yet it's vaccine preventable. Between 2010 and 2018, there have been tens of millions of deaths that otherwise would have happened as a result of measles, but they didn't happen because kids were vaccinated with measles vaccine. And so the problem we have now is that there are millions of children who have missed their measles vaccine and are at risk of having measles. We're now seeing the effects of that. We're seeing outbreaks of measles in quite a number of countries around the world, and deaths of children who are otherwise should be living long, healthy lives.
Thank you, Kate. And here's a very good question from Yusuf Ishak. What's the effect of not taking complete dose of vaccine? Because many vaccines are not single dose, so...
Yeah, most of the vaccines that we have require more than one dose. And you'll remember that the way a vaccine works is that it exposes your body to some tiny part of the germ, either the virus or the bacteria that we're trying to protect against by the use of the vaccine. And it's your body's natural immune system that then responds to that tiny non-infectious particle and creates a defense force in your body against an exposure from that in the future against the real germ. And the reason that most of the vaccines that we have require more than one dose is that your body's immune system requires some repeated training in order for your immune response to be as hardy and as strong and as specific against that particular germ as it needs to be. So for some vaccines, if you get one dose or two doses, you may have partial immunity, but not the full force of the immunity that you would otherwise have if you completed the full schedule of the vaccine. So we always emphasize the importance of completing the entire schedule of the vaccine so that you have the best protection possible from these products.
Thank you so much, Kate. And the whole world's attention in the past year and over a year has been on COVID-19 vaccines. So maybe we can use this opportunity to give an update on vaccination coverage status around the world at the moment.
Yeah, that's a great question, and you're absolutely right. In 2020, there were COVID vaccines that were in development, and at the end of 2020, we finally had some of the evidence that would say that these vaccines worked and that they were safe. So it was really in 2021, just last year, that these vaccines were rolling out, and they've been introduced into every single country around the world with some very limited exceptions. So over 11.4 billion doses of vaccine have been administered. And just to give some context for that, in an average year, absent COVID, the world administers about 4 to 5 billion doses of vaccines across over 25 different diseases. So the fact that we have 11.5 billion doses administered in a one-year period against one disease is absolutely unprecedented. And what does that mean about the fraction of the population that has actually been protected? It's upwards of almost 60% of the world's population has received their complete primary series of vaccine, but it's really different depending on what country you live in. So low-income countries, it's fewer than 15% of people in low-income countries have been fully vaccinated with their primary series. And that's really the tragedy of what happened last year, is that the supply was not going equitably to all countries around the world.
Thank you, Kate. And there is a question from Anthony Pack. Actually, there are two questions from the same person. Do boosters cause variants to thrive? And the second question is, are boosters recommended and for how long?
So great questions about boosters. Booster doses are additional doses of vaccine that we recommend to do a couple of things. First of all, over time, the protection from COVID and also other diseases have booster doses recommended. Not all of the vaccines, but some of the vaccines need booster doses. Over time, the protection that you have from vaccines can wane over time. It can go down over time. And so a booster dose is the way in which you get one more dose after your body has been well trained through the first couple of doses. It's to return your body's immune system to the levels that it was at after the primary doses. So for COVID vaccine, we do see that booster doses are a really important part of getting the best protection possible. And so they are part of the recommended schedule. It's certainly not booster doses that are causing variants. In fact, it's important to get booster doses in order to protect against the emergence of variants, because it's that strong immune response that you have that reduces some transmission, some infection from one person to the next, and actually reduces the amount of transmission that we have in our families and in our communities. And that's the thing that will help reduce variants emerging.
Thank you, Kate. And I think we've been receiving some questions from our followers, whether those vaccines that were made over a year ago are still effective against the new variants, including from those Omicron sublineages that are circulating around the world now?
Yeah, this Omicron variant that has really swept the world, well, we've had multiple variants over the course of the past 2 years. In fact, it's about every 4 or 5 months, in some cases up to about 6 months, that another variant comes sort of through the populations. And we watch really carefully about what the performance of the vaccines are against each of the variants. The vaccines that we have are holding up very well against the Omicron variant, including the sublineages, and they mostly hold up for the severe end of the disease spectrum. So they're holding up well to protect people from being hospitalized, from getting severe disease, and they're holding up well to prevent against death, which is mostly occurring among people who are at risk of serious disease. What they're not holding up as well against is protecting against just infection without disease or infection with mild disease. So it's really at that severe end of the disease spectrum that they're performing very well. And I want to emphasize the importance of getting booster doses to get the best performance out of the vaccines.
Thank you so much, Kate. And some of our viewers are asking as a follow-up if you can clarify what exactly COVID vaccines you're talking about. So maybe we can remind them on what vaccines have been listed for emergency use by WHO. And also some are asking, are there any new vaccines on horizon for COVID-19?
Yeah, I can address that first one. There are over 300 vaccines that are continuing to be evaluated and developed. And one of the reasons that both vaccine manufacturers and academics and researchers around the world are still pursuing developing new COVID vaccines is partly so that we can have vaccines that are easier to administer. We'd love to have a vaccine that was administered either orally or nasally, or even a vaccine that might be put on a skin patch that you could just put the patch on like a Band-Aid and get vaccinated that way. So part of it is about how the vaccine is administered. And the other thing that we're continuing to look at from a research perspective are vaccines that might protect against more of the coronaviruses. The coronavirus that's causing COVID is just one in a series of these kinds of viruses that are around the world. And we'd love to have some vaccines that protected against a broader number of coronaviruses. Now, the listener also asked about which are the vaccines that are authorized for use by WHO. So we've authorized over 10 vaccines now, and they fall into a few categories. There are a number of different ways that you can make a vaccine. So there are mRNA vaccines. We also have viral vector vaccines. There are inactivated vaccines. And the fourth category are protein vaccines. And within each of those four categories, we have one or more vaccines that are made by different manufacturers, and each of them have to meet strict safety measures, and they also have to demonstrate that they can actually prevent disease. And each of those vaccines also is evaluated for their manufacturing quality so that you can be assured that the vaccine that you're getting is a safe, effective, and well-manufactured product.
Thank you so much, Kate. And I think we're receiving a few questions on misinformation regarding vaccines, concrete ones that I think it's good that we take this opportunity to debunk them. And one is about vaccines having chips. So this has been following us since the beginning of this pandemic. So maybe you can explain once again what are the actually ingredients of COVID-19 vaccines and clarify that they don't have any chips.
Yeah, this is simply a piece of absolute false information. There are no vaccines that have any sort of microchip in them or non-microchip. That's just a false story that is circulating out there. All the ingredients that are in vaccines are tested for their safety, one ingredient at a time. And then the quality of those ingredients are also monitored for the performance in a vaccine. But this idea that there are microchips in vaccines is simply false.
Thank you so much, Kate. Here is another one that would be good to clarify whether there have been any deaths recorded after receiving a COVID-19 vaccine.
So in very rare circumstances, for some of the vaccines, there have been some very rare, serious adverse events, side effects from the vaccine. And this is, of course, a tragedy, and it's something that is taken very, very seriously. For one of the types of vaccines, I think people remember that there was an issue with blood clots that were produced following the receipt of the vaccine. Again, a very rare occurrence, and something that has been now studied quite well, and there's much clearer understanding of why it occurs, in which risk groups, and what can be done about it. In other words, treatment for it. So one of the most important things about monitoring safety, which we do throughout the whole development of a vaccine, and the safety monitoring doesn't stop there. Safety, in fact, is monitored for every vaccine that we have, regardless of how many years it's been since those vaccines have been in routine use. So it's a constant safety program for vaccines. And one of the important things about safety programs is that we do learn what those very rare side effects are so that we can actually prevent them. We can either treat them and understand what the early signs are of rare side effects, or even modify the vaccines so that they don't actually produce those rare side effects.
Thank you, Kate. Our focus today is vaccines, but I think it's worth mentioning because one of the viewers is asking, are vaccines the only tool to prevent COVID infection?
You know, this is a great question. It's not only about vaccines, it's vaccines and for COVID, and frankly, for most of the diseases that we immunize against. For COVID, it's about vaccines and taking care of all of the other interventions that work. Masking, when you're not able to keep distance from people or you're in crowded circumstances, hand washing, being in well-ventilated areas. These are all strategies that work against the transmission of the virus that causes COVID. And we have some treatments now for COVID as well. So these are all important interventions to put an end to this pandemic.
Thank you so much, Kate. Here is a great question on World Malaria Day. So I'm very grateful to Lucien, who is asking, what are WHO plans about malaria vaccine? Very important for Africans like us in Benin.
Fantastic question. You know, in 2021, we had not only COVID vaccines as you know, a really bright light in what was a pretty difficult time, but we also have the world's first malaria vaccine that was authorized for use and recommended for use by WHO and funded to deploy by Gavi. So this is a vaccine for young infants. And malaria is one of the most important causes of serious disease in young infants in parts of Africa and other parts around the world. So this is an incredibly good news story to have the world's first malaria vaccine already being rolled out in 3 countries, Ghana, Kenya, and Malawi. And these doses are going to be made available and will be rolling out soon in other countries in 2020, end of 2022, early 2023.
Thank you, Kate. This was really a great question, and happy World Malaria Day to everyone. We have a question from Muhammad Shafiq. There are so many vaccines for different diseases. So what should be the interval period from one to another vaccination?
Well, the first thing about vaccines is that your body, your immune system, is an incredibly powerful system. On an everyday basis, through your hands, your nose, your mouth, your body is exposed to lots of different germs that are just out there in the world and cause no harm to you. So there's no harm in actually being vaccinated with more than one vaccine at a time. In fact, as a mother of kids who are now adults, but when they were little, there's really no harm in vaccinating with 2, 3, or 4 vaccines at the same time. Your body's immune system can handle that. It can recognize the different vaccines that are being had. From my perspective as a mother, I preferred to bring the kids once. They're gonna cry. They're gonna be upset about the injection they're getting. We may as well get them done all at the same time rather than spacing them out. But for any one vaccine, there are intervals within which the multiple doses should be given. And that's because the immune system needs time to actually respond to the first dose and mature itself when the second dose is given. In fact, for some vaccines, the little bit longer that you wait, the better the response is. But really, everybody should follow whatever the recommendation is in your own country for the interval between doses and the schedule that each country has.
Thank you, Kate. And as the theme of the World Immunization Week is Long Life for All, so we're talking about different vaccinations throughout the life course. So can we maybe remind viewers about what are the routine immunization for children, but what are the vaccines for adults? So maybe we can motivate them to check if their vaccinations are up to date, and if not, to get it done.
Yeah, and this is one thing that everybody who's listening can do. People often ask, well, what is it I can do for World Immunization Week or to support immunization? And the first thing to do is to check your own immunization status. So I do find it, of interest and surprising that most people rely on their physician or their healthcare provider to know what vaccines they're due for. And I would really encourage everybody to have your own home-based record of what vaccines you've had. We're very familiar with the vaccines that kids get as infants, but remember that there are also vaccines that adolescents get, especially adolescent girls, against HPV, which is a virus that can cause cervical cancer. In fact, it's the most common cause of cervical cancer. And when we think about the rest of this decade, the greatest number of additional deaths that can be prevented is by ramping up HPV vaccine in countries around the world that have not yet introduced HPV vaccine for girls. Boys also benefit from HPV vaccine, but the primary target is for girls to be vaccinated. And then as you age, especially in older age groups, vaccinating against influenza or pneumococcus, which is also called the pneumonia vaccine, are important vaccines for older adults. Adults tend to get more susceptible to a serious case of influenza or to pneumonia germs. And so this is a really important group of vaccines for adults to get as you get older.
Any recommendation for pregnant women as well?
Yes, so pregnant women, there are a number of things that women can do to protect themselves and to protect their babies. The first and foremost is to be sure that before you're pregnant or during your pregnancy, that you're protected against tetanus. And that protects both you and it protects your baby from tetanus. Depending where you live in the world, influenza vaccine is another vaccine that is recommended during the course of pregnancy. Again, because your immune system is in connection with your baby's immune system, that when you get vaccinated, there is a transfer of that immunity also to your baby so that when they're born, they have some protection already. So those are a couple of examples of the important vaccines during pregnancy, along with pertussis, which is another one.
Thank you so much, Kate. And we have now vaccines for over 20 preventable diseases, but are there any new vaccines on the horizon? I mean, 2021 was historic year, you just said, with malaria vaccine and COVID vaccines, but what are the vaccines that we may expect in the near future?
Yes, there's a whole vaccine development program that continues to look at vaccines that would be against diseases that are important to prevent. And we don't take vaccines lightly. We're looking always for those germs, those infections that are most important. So a couple of things that are on the horizon. One of the most important causes of serious lung infections in young babies is a virus called RSV. And there's a really strong group of vaccines that are coming through for RSV, and we do expect those to be available in the next year or two. We're also looking for vaccines that have been really difficult targets, and in particular HIV. So it's been over 40 years that the effort has been made with truly billions of dollars put behind this to try to find, to develop a vaccine that will work against HIV. There is progress being made, but this is continuing to a target that's quite difficult. Tuberculosis is another one. We do have a vaccine against tuberculosis. It's called BCG. It's given to infants at the time of birth or soon after in many countries, but not all countries around the world. And we're now looking at vaccines that will enhance that protection already in teenage years or adults who have been infected already but might not have disease from tuberculosis. And we're also looking at vaccines against some of the diarrheal diseases. Shigella is an example of a vaccine that is being developed.
Thank you so much, Kate. Here's another question on malaria vaccine from Ehab Haron. Will malaria vaccine be scheduled among obligatory or mandatory vaccines or just on traveling to Africa?
So the malaria vaccine at the moment is really for children who are living in Africa, those children who are exposed in high exposure settings, who have a significant risk of malaria. This particular vaccine is not intended as a travel vaccine, but there are other malaria vaccines that are being developed that would be travel-related vaccines. So at the moment, it's really about children who are living in parts of the world where malaria is common, either seasonally or throughout the year, and they have high risk of serious malaria disease.
Thank you so much, Kate. You mentioned that 23 million children missed on routine immunization in 2020. So what are the greatest impediments to get vaccines to those who need them the most?
Yes, these kids who miss out on vaccines, there are a number of reasons why they aren't getting vaccines. Some of the reasons are that when we think about vaccine programs, they may not be at the time and place that is convenient for very busy families, especially mothers, to be able to take them. So part of it is distance to a clinic, the frequency that the clinic is open, whether the clinic has vaccines all the time or whether at times the supply of vaccines is not there. The other reasons why kids miss out on vaccines is that they may be part of communities that are quite marginalized communities in a country, in a city. And there are also many settings that are conflict-related settings or humanitarian settings where the services for vaccination are simply not available. And unfortunately, those conflict settings and humanitarian situations are increasing in size and frequency and affecting more and more children around the world.
Thank you, Kate. Vaccine hesitancy has been a hot topic throughout the pandemic and even before. So what are, in your opinion, main drivers of vaccine hesitancy?
Well, one of the things I want to say is this is a topic that has been quite an important topic of conversation, and especially on social media. But vaccine hesitancy is not the main reason why people don't get vaccinated. So we don't want to overstate the importance of this issue. People who are vaccine hesitant kind of fall into different categories. There's a very small group of people who are simply opposed to vaccination. And usually among this very small group of people, the concern about vaccines is usually misinformation that they have received, and largely it's misinformation about the safety of vaccines or misinformation about the way that vaccines work. But a bigger group of people among those who are hesitant are those who are just unsure. And they may have received information from community leaders, neighbors, friends, family, that cause people to question the value of vaccines and may not have credible information about the seriousness of the diseases that vaccines are intended to prevent. And this is a group of people who it's really important have access to and seek credible information. There's so much misinformation out there on the internet. It's really easy to go down a rabbit hole and start looking at things that are just frankly inaccurate or intentionally misleading. So very, very important for people to seek information that comes from credible sources. Their Ministry of Health, certainly the WHO website, the UNICEF website, credible sources of information.
Thank you so much, Kate. And what are the risks of those gaps in routine immunization? Are there any big outbreaks at the moment around the world?
So there sure are outbreaks happening. And part of this, just hearkening back to what happened in 2020 and 2021, when the immunization program was backsliding in terms of its performance because people were in lockdown, they weren't seeking care, they weren't seeking immunization services. So we've actually lost about a decade's worth of progress on immunization, although there is great anticipation that this can be caught up quickly with the right resources going into countries and the commitment of country programs to stand them up again. We are seeing outbreaks, increasing number of outbreaks of measles around the world. We're also seeing yellow fever outbreaks, diphtheria outbreaks, and we're seeing outbreaks of related to polio as well. So big concern that it's not the time to be complacent. It's now is the time actually to double down, accelerate, put our foot on the accelerator pedal, and do everything we can to support country programs to get back to where we were and better than we were in 2019.
Thank you, Kate. And speaking about COVID vaccination and coverage, we set the target of 70% of population in every country to be vaccinated by mid-2022. So are we on track? And if we are not, what are the risks?
Yeah, so about 52 countries have reached that 70% of the population immunization among the 194 member states of WHO, and there are another 8 that are on track to probably meet that target by the end of June. That means that there are a substantial number of countries that are going more slowly. The first thing to say really is that there's enough supply in the world to get to these targets. It's no longer about supply of vaccines, but it is about catching up on what was a very difficult year last year in many countries. And I mostly want to emphasize that as countries pursue their own target for how far they want to go in vaccination coverage, the most important thing is that those people who are at highest risk of COVID disease, so that means health workers, older populations, people who have underlying conditions that would make them have a weak immune system, so immunocompromised populations, and certainly essential workers, teachers especially, other essential workers. We want to assure that 100% of each of those groups are vaccinated, that that's the priority to protect health and assure that the health system doesn't get slaughtered again by potentially other waves that might still come through of different variants of COVID.
Thank you so much, Kate. And before we close, there is one more question about malaria vaccine. And again, on World Malaria Day, we must take this one. So Iya Saserut Niaba is asking, so is the malaria vaccine only for children? And what degree of protection does it offer?
Yeah, so this malaria vaccine, the world's first malaria vaccine, is for children. It is targeted to infants. And this is a vaccine that is protecting children. It certainly is not a fully protective vaccine. In fact, there's almost no vaccine that is fully protective, 100% protective. But this is a vaccine that is protecting upwards of almost half of the severe end of the disease spectrum of malaria, also protecting against needing blood transfusions for children who are really severely ill with malaria. So it's making a big contribution in addition to the other interventions that need to be continued. That includes bed nets. It includes spraying for mosquitoes. It includes other ways that all of the malaria interventions that are present in a community. That's not time to stand those down. This is on top of, and again, providing even greater protection, especially against death from malaria.
Thank you, Kate. And as you're mentioning all the tools we have in hand, however, I think the theme of today's campaign on World Malaria Day is actually calling for inventors and the investments into new tools that could help us end malaria one day. And maybe last question for today, in this theme of long life for all, how each of us on individual level can help to get more vaccines into people's or children's arms and enable long life for all.
Yeah, so on the long life for all, first thing that everybody who's on this program can do is check your own vaccination status and check the vaccination status of your loved ones, your children, brothers, sisters, cousins, parents, grandparents. Make sure that the people around you are fully up to date with the vaccines that they need. Second thing you can do is support vaccines in your community. And that means talking to friends and neighbors. So if you're hearing about information that's just frankly wrong information or it sounds odd to you, if something sounds strange, it's probably something worth checking out. And generally what I hear is sort of strange stories about vaccines are almost always some piece of misinformation. So make sure that you're seeking information that comes from credible sources, and talk to your friends and family, especially when you're hearing people that are hesitating or that are talking about things that simply aren't true. And then the next thing that you can do is also be fully aware of the vaccines that are provided. Almost always in every country it's through a government program. So you can be very supportive of the program that your Ministry of Health has And especially in COVID time, there have been lots of calls in different communities for volunteers to help take older people to a place where vaccinations are being given, volunteers to just help run a campaign that's going on. There's so many health workers that are needed to get so many people vaccinated that volunteerism is a great way to help. And then the final thing is when you think about something more that you can do, is supporting UNICEF, WHO, and other institutions that themselves are helping countries get the strongest programs that they possibly can. And so that's direct on-the-ground work that we do to support the vaccine programs and get as many people vaccinated as possible.
Thank you so much, Kate, for today, and thanks to all our viewers for great questions. And for those watching us from Iran, Ivory Coast, Tanzania, Uganda, Cambodia, India, Philippines, South Africa, El Salvador, Germany, DRC, Brazil, Mexico, Yemen, Lebanon, Cameroon, Turkey, the UK, and many others, Pakistan, Angola, just to name a few. Happy World Immunization Week. If you are active on social media, please join the conversation. Use the hashtags Long Life for All or World Immunization Week. Check WHO channels and amplify our messages. We are grateful to speak loudly this week about the power of vaccines and to help us pursue long life for all. Thank you.